Welcome everybody to a introduction to clinical ultrasound. My name is Jalen. I am one of the ultrasound fellows, and today we're going to get a very brief primer on the ultrasound basics for the kidney and the gallbladder. Let's get started with the kidney. So as a general review of anatomy, we have two kidneys, kind of sits behind on our flanks. We have a renal artery that delivers blood into the kidney here. That blood is going to get distributed into our glomerulars, and that's going to process all that blood. Some of the blood's going to come back via the renal vein, and then the urine that now gets processed gets dumped into this central pelvis here. Now that pelvis collects the urine, goes down the ureters, goes into the bladder, and that bladder comes out your urethra. As a general, we have the outside of the kidney known as the cortex, and the inside is going to be our medulla. Here is a general ultrasound schema. You can see liver kind of right on top, the general shape of the kidney, and that pelvis in the middle. Now, when we're imaging our patients, typically we have our patients laying supine, and so our kidneys kind of sit this way. So the kidney is a ovoid shape, and so we kind of describe it in a long and short axis. So you can imagine if we're holding our ultrasound probe in this direction, the coronal direction, we're going to create what's called a long axis image. And if we hold it more in a transverse orientation, where the probe is kind of going towards the ceiling and towards the floor, we're going to create a short axis orientation. And here are some ultrasound examples of that: long axis and short axis. Now, the most common clinical question that we ask when we get a kidney ultrasound is there a sign of obstruction? So you can imagine in a healthy kidney, to our left, urine is dumping easily into the bladder fills up, and that urine gets dumped out. But for some reason, if we have any form of an obstruction, in this case a kidney stone, could be a mass, whatever you want, you're going to get a backup of urine. That urine is going to say, nope, I'm not going down that pathway. And eventually it's going to create pressure and expand that pelvis. And so that expansion of the pelvis is what we call hydronephrosis, or a sign of kidney obstruction. So here are some examples. You can see when we have a mild one, the pelvis just looks a little more prominent. It's a little more fluffy, if you will. And then in very extreme cases, that pelvis overwhelms the entire anatomy of the kidney. Here, all you see is that dark fluid, and you can barely even make out the medulla or the cortex. All right? So let's shift gears to the gallbladder. The gallbladder is a structure that sits behind the liver in the right upper quadrant. Its main job is to carry bile. So the liver will make bile, kind of go in through the hepatic duct that then fills up the gallbladder with this bile. And when we need to digest, it will come out down the cystic duct into the common bile duct and ultimately into our duodenum, where we can make that digestion happen. And as a general sense, this is the top of the gallbladder. Here is going to be your fundus, and down here near all the ducts is going to be your neck. All right? Now, imaging the gallbladder is a little trickier. For most folks, it can sit sometimes in an upward, sometimes in a more sideways direction, and so the axes are a little hard to define. But when it comes to imaging, we have generally a long axis where we can see that ovoid shape of the gallbladder, and then a short axis where we're cutting it more like this, and we get more circular shapes. There are two positions where we can image the gallbladder, and every patient, or in this case model, is going to have one that works probably a little bit better. You can either go sub-xiphoid, under the ribs this way from the belly down, or you can come intercostal from the ribs and view it that way. Okay, and we can try both with our models. And the most common clinical question when we look for gallbladders on ultrasound is, are there gallstones? Gallstones typically cause most of our gallbladder pathology, and so you see it, it suggests something's bad going on. So in general, gallbladders are filled with bile. Bile is mostly fluid, and so it looks very dark, or we call anechoic or hypoechoic on ultrasound. The stones tend to be very bright, and so here we have an example. You can see right on the bottom layering of that gallbladder, see these nice bright stones. Here's another example, and another. And I just want to point out, these stones have a very interesting artifact on ultrasound, which is called shadowing. And so you can imagine if this is the ultrasound beam, it's kind of looking at things, sending a wave out. What is this? Oh, this is the little gallbladder wall. Let's put it on our screen. What's this? That's the other end of the gallbladder wall. Put it on the screen. And it comes down to these stones. And you'll notice it'll basically scan the stone and get the top edge of that stone. And so you can imagine the machine will create that figure here. And it says, yeah, I see some stones. But when it tries to shoot a ultrasound beam behind it, that stone is so dense that it blocks it and shoots it right back up. And so ultimately, the stones behind them is invisible, and you'll create these dark shadows behind that stone. And these clues are very important because sometimes stones are not as obvious. So take a look at this one. Here, the stone, we can't even see the full shape of that stone. It's sitting by itself. But you see the top kind of outline on the front and that classic shadow right below. And that characteristic is a classic finding for stones. So gallstones look for that bright top layer and then that shadow right behind it. All right, that's it for the primer. Let's get scanning.